Canine hip dysplasia in dogs can be caused by both genetic factors as well as dietary. It's particularly prevalent in large breed dogs. Before purchasing a large breed dog, you really should check to see that both parents are certified not to have hip dysplasia. The Orthopedic Foundation of Animals, OFA, certifies animals. This precaution will save you from needing to deal with the grief you and your dog will experience if he or she has the condition, which helps stop passing the genetics on to future generations. Very simply, in this diagram, you see a normal hip joint fitting into a socket. With dysplasia, for a variety of reasons, it does not have a neatly seated location and it pops out of the hip joint if it attaches to it at all. Hip dysplasia is an abnormal formation of the hip socket. In more severe cases, it will produce crippling lameness and result in painful arthritis affecting the joints. It's usually a genetic situation that can be significantly affected by environmental factors. It occurs in a variety of animals, including humans, but is most frequently seen in dogs, particularly the larger breeds. In young dogs, the hip is not properly situated in the ball joint, resulting in movement that can lead to arthritis and degenerative joint diseases. Many dogs will develop lameness, which isn't always dependent upon the degree of dislocation as seen on x-rays. The pain and loss of use of the limb has more to do with the degree of arthritis that sets in as a result of the condition. So if your dog is diagnosed with hip dysplasia early on, there are steps you can take to help alleviate the issues. Now, how is it diagnosed? The preferred method of diagnosis is an x-ray. However, you may notice joint looseness by observation. Weakness and pain in the hind legs are the first signs that many people notice. The dog will tend to be wobbly and or slow to rise from a lying down or sitting position. If you notice any such behavior, it's to get them to a vet so the x-rays can be done as soon as possible. Now, some breeds are definitely higher at risk. As that said, almost any breed can have and experience hip dysplasia. However, St. Bernards, Labrador Retrievers, Golden Retrievers, Bulldogs, and German Shepherds in particular are among the breeds where hip dysplasia is most prevalent. Mixed breed dogs are also at risk. These animals should be fed a special large breed growth diet during their first year. Check with your veterinarian for advice on the appropriate regimen. Treatment options depend on the degree of pain the animal is experiencing and clinical examination. Most treatment starts with NSAIDs, non-steroid anti-inflammatory drugs. These tend to have minimal side effects. Just which medicine works best is an individual thing, and you may need to rotate through a couple different ones to find the one most effective for your animal. If there's insufficient reduction of pain, you may need to move to a surgical solution. Usually vets will do a triple pelvic ostomy in young dogs while choosing a femoral head ostectomy in larger dogs, older dogs. The decision ultimately comes down to the dog's condition and lifestyle. Don't pass it on. If your dog has hip dysplasia, don't breed your dog. That's why we encourage you to get your parents of your new puppy checked or certified before you take a puppy from a dog that's been certified by OFA. If you happen to live in the Park Rapids, Minnesota area, I recommend you talk to the veterinarians at the Ark Animal Hospital. They're professionals that will provide your animal with loving and professional care. This is Earl Netwell on behalf of the Ark Animal Hospital, wishing you and your dog a great day and a healthy life. Bye-bye.